Pediatricians in hospitals across the U.S. are seeing record numbers of children with respiratory viruses like RSV, influenza, and COVID, leading to longer emergency room wait times and reduced capacity. Joining us to talk more on what steps parents and caregivers can take and how to recognize the symptoms is Dr. Joanna Parga with the American Academy of Pediatrics. Welcome to the show.
Yeah, thank you so much. It's such a pleasure to be here.
Yeah, well, first off, what is causing the surge in children's hospitalizations?
We think there are multiple factors that are contributing to this surge. So the first is that kids are getting sick from these viruses, and they're getting sicker than usual, and it's been earlier than usual in the viral season. So it's been a little bit more unpredictable. That, and we're actually seeing increased hospitalizations as well due to mental health concerns for children at record numbers. So you've got this combination of kids being sick from viruses and also this mental health crisis that we're dealing with. There's also decreased pediatric beds across the country. This was a problem before COVID and has become more exacerbated. So there's not the capacity to have pediatric beds. There's also not the staffing for these pediatric beds. So healthcare professionals are burnt out, and pediatricians and pediatric healthcare professionals are no exception. And so there's just not the staffing for these beds either.
And Dr. Parga, why are more children getting ill?
That is a great question. I wish I had an exact answer for you. You know, we used to be able to predict the viral season. So we used to be able to predict when viruses like RSV would hit, but it came earlier this year. And part of that, we think, is because the COVID-19 pandemic sort of threw off the typical seasonality of viruses. And in addition, younger children less than 5 haven't seen these viruses before. You know, in the past 2 years, we were doing more infection prevention, so masking and physical distancing. We're not doing those things anymore. So it could be also that these younger children are seeing these viruses for the first time.
And so what steps can parents and caregivers take to prevent these illnesses?
I'm so glad you asked that, because there are things that we can do to help prevent the spread of illness. And the first thing that comes to mind is vaccination. So we can get vaccinated as adults, and then children who are greater than 6 months can get vaccinated for COVID. There are even COVID boosters for kids who are greater than 5 years. And then there's the flu shot. You can get the flu shot at any time. So it's not too late to get the flu shot, even though we're already seeing increasing numbers of the flu. So vaccination, it's not only good for helping to prevent the spread of disease, but it's also actually really good for decreasing the severity of disease. So you're likely to get less sick if you're vaccinated and not need to be hospitalized. And then there's infection control prevention measures that we can take in our communities. So one is, if you're sick, and this is really hard, if your kid is sick, trying to keep them out of school or from going to daycare to try to stop the spread of disease. And the other thing is just washing your hands. That is actually so important and something you can do every day and think about doing. And when you're coughing, try not to cough in your hand, try to cough in your elbow. So again, these little things might help prevent the spread of disease.
Absolutely. And where can we go for more information or resources?
I love the American Academy of Pediatrics resources. So there's healthychildren.org. And you can also take a look at the Centers for Disease Control to look at this viral surge.
Dr. Parga, thank you so much for joining us.
Thank you so much for having me.